Hello and welcome to The Power of Positive. My name is Charmaine Picardo. Thank you for joining us on today's episode. The show brings visibility to the lived realities and challenges as well as successes faced by women and girls living with HIV through discussing strategies to overcome stigma and discrimination and ensure that women and girls have greater access to treatment, care and support, as well as celebrating the heroines of the HIV response movement. Today we're going to be talking about health systems and services. Joining us today is Dr. Tsitsi Apollo, Deputy Director, HIV and AIDS and STIs in the Ministry of Health and Childcare. Dr. Apollo, welcome to The Power of Positive.
Thank you very much, Charmaine. I'm happy to be here.
Thank you. Dr. Apollo, when we are looking at the current state of services and the health system in Zimbabwe, how have they been progressive, or have they been actually progressive in addressing the services as well as responding to the needs of people living with HIV in Zimbabwe?
Thank you, Charmaine. In Zimbabwe, we have a very comprehensive, very robust system and structures in place for health services and for HIV services in particular. So at national level, we have the national programs that are basically mandated to formulate appropriate policies and to develop guidelines that are evidence-based, that meet the international standards. And these have been evolving over the years to make sure that we provide relevant policies in place to support HIV services in the country. So we have a very decentralized, fully decentralized system and structure where we do have services at primary care level, second level, tertiary level, and at the highest level. So most services can be accessed very close to where people live in the country. I'll give an example. The National Antiretroviral Therapy Program, which was started in 2004. This has been rolled out to the country with over 95% of public health institutions offering antiretroviral therapy services. And we've managed to enroll close to 1.2 million people who are currently receiving care in Zimbabwe, which is a significant achievement that we've managed to do. We do have a very strong health workforce, which is in place. Our role is also to capacitate, building a capacity of healthcare workforce to provide quality and comprehensive services for people living with HIV. So we do have training and a mentorship program which is in place, where we train our doctors, our nurses, and other healthcare workers to provide quality services that meets the expectations and preferences of people, of our clients and recipients of care. So we do use an approach which is called differentiated service delivery approach. And this really puts the clients at the center of our responses. What are their preferences? What are their interests? And therefore we tailor make our services to suit the needs of people living with HIV. So we've been rolling out these models of differentiated service delivery, among other packages of services that we are offering. I just want to give you an example in terms of the progress that we've made towards the UN fast-track targets, the 90-90-90 targets. As a country, we've done very well. If you look at the first 90, which is about the proportion of people living with HIV that know their HIV status. So about 86.8% of people living with HIV know their status. And then on the second 90, we actually overachieved. We did so well. 97% of people living with HIV who know their status are actually receiving treatment, which is phenomenal. And then on the third 90, which looks at viral load suppression, we also did well. 90.3% of people living with HIV on antiretroviral therapy are virally suppressed. So we do have a population of people living with HIV who are established on treatment, that are virally suppressed, and they are doing well. So these are achievements that we've made. However, we do have certain gaps, areas that we need to address within our systems, within our programs. We need to strengthen quality in terms of laboratory monitoring of our patients. We need to ensure that patients receive their results in a timely manner and reducing the turnaround times for relay of results, such as viral load results, when the tests are done. We need to also ensure that we provide quality services, so we have a quality improvement program, we have a mentorship program that really helps to just close the gaps in terms of programming. We're looking at mental health issues among people living with HIV, and therefore we're developing packages like stepped up care approaches to ensure that we manage people living with HIV with common mental health conditions. So these are among some of the interventions that we're putting in place within our programs to ensure that we provide quality and comprehensive services for our populace that meets their expectations and their needs.
And from your responses, Dr. Apollo, phenomenal results, really. I think the country has done really well in terms of responses for people living with HIV. But now when it comes to prevention of new HIV infection, I know with the last 90, undetectable equals untransmittable. But looking at the other strategies that the government of Zimbabwe has put in place to ensure that we curb new HIV infections. For example, looking at the comprehensive sexuality education program within the schools to ensure that we address new HIV infections amongst adolescents and young people. Has that really worked, especially when we look at the rate of new HIV infections amongst adolescent girls and young women?
Okay, so adolescent girls and young women, this is one of our priority populations that we are targeting. Because if you look at the greatest brunt of the epidemic, this is the population that really bears that. And we really need to target them in terms of prevention programs. And we're looking at a curriculum that is in place within primary and secondary schools. And we are working in very close collaboration with our other line ministries that we work with, like Ministry of Primary and Secondary Education. We're working also closely with organizations like UNESCO as well as UNFPA. So we are collaborating with NAC as well, the National AIDS Council, to just make sure that we support this program of comprehensive sexuality within our learners in schools while they're still in school. The aim is really to reach out to these young girls and boys when they are still young with correct and factual information that pertains to establishing relationships, reproduction, reducing risky sexual behaviors that put them at risk of contracting different diseases, promoting health and well-being, and those kind of things that we train them while they're still young. We are aware that in our country, the median age of sexual debut or sexual intercourse is about 19 years among females and about 20 among males. And therefore, we really need to start early in terms of providing accurate information as pertaining to health and HIV and AIDS. We also aim at providing information to do with access to services. We do have a number of interventions within the Ministry of Health, a number of programs. We would like young people to also be able to access HIV testing services. We do have Hiv Self-Test nowadays, which is really an important intervention which has been introduced into our programs. And we have seen that with HIV self-testing, some populations like adolescents and men that didn't used to access services as much as the other populations are quite interested in utilizing that particular tool. And therefore we see this as a unique opportunity to expand HIV testing to the young boys and girls and young women. So it is offered within our public health institutions. We also have other services that we inform these learners while they're still in school. We do have programs like voluntary medical male circumcision for boys. They can access those services. We also have pre-exposure prophylaxis for those that are at substantial risk of contracting HIV, and even post-exposure prophylaxis, because there are some that can be survivors of sexual violence. They can be raped, and therefore we do have a package of services for management of the sexually abused children. So the post-exposure prophylaxis program is also available for them to access. And also there are some children that are born with HIV through vertical transmission from their mothers. And therefore it's important for them to be supported while they're in school, to be aware that there is a fallback plan, there is support for them in terms of psychosocial support, and they're able to adhere to their treatment while they're in schools, in boarding schools as well. And so those are some of the programs that we also inform the children while they're still in school using this comprehensive sexuality program.
Mm-hmm. And speaking of some of the services that you spoke of that are readily available within the public health institutions, is this information then also readily available to the populace? Do they know that they can access the services? For example, if we're looking at key services or key commodities such as HIV Self-Test Kits, as well as the pre-exposure prophylaxis, because we know the self-test kits are also available on the commercial market. However, the price range makes it unavailable to some adolescents and young people. So what strategies has the Ministry of Health put in place to ensure that the commodities are readily available?
Okay, so as I mentioned before, HIV self-testing is really a game changer in terms of allowing maybe those populations that would otherwise not access HIV testing services. Now they're able to utilize that tool and test themselves while they're in their own private spaces. You know, so it is really an opportunity for young people, boys and girls, to access HIV testing services. We do have provision within the public health sector where we offer HIV self-testing free of charge. So they can actually access, if they walk into a public health clinic or hospital, they're able to get a test kit, they're able to test themselves within the facility or even at home or any other space that they feel comfortable where they can be tested. But we need to be aware that this is a screening test. It's not confirmatory test. So once they've tested themselves, if they're found to be HIV positive, they need to visit the nearest facility for them to have a confirmatory test. Yeah, so, but it is available. We are also aware that the private sector has some HIV self-test kits that are available for those that can afford. They're likely to be more expensive. They might be expensive, yes. However, we were looking at engaging the private sector where we can have a public-private sort of partnership where they can also offer those HIV self-test kits, so they can be an additional outlet at selling them at a nominal fee where people can afford. But for young girls and boys who want to have an HIV self-test kit, it's available within our public health facilities and it's offered for free. Yes. We also have community-based distributors. So especially during this COVID-19 era, we expanded the distribution of HIV self-test kits, and we saw a massive increase in terms of distribution compared to the conventional test kits that we use. And therefore, it is available and it's offered for free within the public health sector.
Okay, thank you very much, Dr. Apollo. We're just going to take a short break now, and when we come back, we'll continue with this conversation. Join us in our second segment.
I'm committed to helping women access justice and better health care as a he-for-she ambassador.
And so, today, I urge you to join me and others to ensure a safe environment for all women.
Welcome back. Thank you for staying with us. We are joined by Dr. Tsitsi Apollo from the Ministry of Health in Zimbabwe as we discuss the health systems and services for people living with HIV. Dr. Apollo, welcome back to the second segment.
Thank you, Charmaine.
Okay. Dr. Apollo, despite the efforts that have been put in place, by the government of Zimbabwe, by AIDS organizations and activists and civil society within the wider HIV response movement, we still are getting reports of stigma and discrimination of people living with HIV at health facilities. So what measures has the Ministry of Health put in place to ensure that we are addressing issues of stigma and discrimination? Especially, when it comes to healthcare workers?
It's really sad if we continue to see or hear experiences of people being stigmatized or being discriminated against during this era where HIV has been with us for decades. And we've made inroads in terms of addressing the HIV response in a phenomenal way. So. But I would like to say that we have seen over the years that there's been less and less stigma. We're working very closely with our partners that are working towards helping to address stigma and discrimination. From the perspective of healthcare workers, we train our healthcare workers to provide client-friendly services. We train them not to be judgmental to clients. We spoke earlier about client-centered care or client-centered approaches where our services are really tailor-made to meet the preferences and expectations of our clients. So we do train our healthcare workers to have a listening ear to clients, and provide services in a confidential spaces within health facilities. And not to discriminate them. So this is something that we're trying to do. With the advent of antiretroviral therapy and where we've seen that people are living well, they're living longer, survival has really improved over the years. So people have seen their family members, their friends who were at their deathbeds, but they've done so well, So that has also helped to reduce stigma where people are seeing the benefits of antiretroviral therapy. And it's a privilege now to be able to access these services and to live longer. So it's something that has really helped to reduce the level of stigma in our society. And this is very important, but you still find in some instances whereby it's a woman that has come to our facilities, is pregnant, they've been tested, they're found to be positive, and now they have to start treatment, they're encouraged to disclose their status. Sometimes it's difficult for this woman. They begin to imagine how will their spouse react. Could there be violence? Could there be rejection? Could there be divorce? So you still find those kind of issues emerging. But we've trained our healthcare workers to be able to support clients and to offer client-friendly services and not to stigmatize or to discriminate anyone.
Mm-hmm. And just to take you back a bit to the scenario that you gave of the pregnant woman coming to the facility, are there systems of psychosocial support that are very strong within the institution as well within the community to support women and girls? Because we know there's still, the skills are still a bit skewed when we look at gender equality and issues of HIV and AIDS.
Okay, so we do have a number of interventions within facilities and also in the communities. Within facilities, healthcare workers do provide counseling and psychosocial support. We do have counselors within our facilities. Nurses are also trained in counseling, but we also have primary counselors in place that also support these mothers or women and young girls within facilities so that they're able to accept the HIV status if they have been diagnosed HIV positive, and to be able to support them, to disclose also to their spouses. So we encourage them to bring their spouses to facilities. If they're not able to disclose them themselves, then they can be brought, encouraged to come to facilities, and healthcare workers can support the disclosure process. Within communities, we also have some programs like the Young Mentor Mothers, programs whereby young women who have gone through experiences, have given birth, and they're HIV infected, they also support other young mothers so that they accept their HIV status and they live healthy. They adopt healthy lifestyles and they take their medications, they support their babies, and they meet to offer psychosocial support and counseling and other things. So there are mechanisms in place to really support these young girls and mothers in the HIV response.
And just before the break, Dr. Apollo, you had started to talk about some of the measures that the Ministry of Health has put in place, with the advent of the COVID-19 pandemic. But now we've had reports of commodity stockouts or commodity supply chains being affected because of the pandemic. So what measures has the Ministry of Health put in place to ensure that people living with HIV still have access to treatment, still have access to care as well as support?
So that's a very interesting question and an important one as well. So when we had the first case of COVID-19 in Zimbabwe around March last year, within weeks, or within days, I will say, as early as April, we developed a rapid guidance, which is a technical guidance for healthcare workers for them to be able to support clients and to continue to provide the essential and critical HIV services. So this was very helpful because it gave clinicians step-by-step guidance on what to do amidst the pandemic, the COVID-19 pandemic. What we noticed was that we had challenges in terms of uptake of services, especially during the full lockdown in April, and also April 2020, as well as January this year. But we had to put in place mechanisms to sort of mitigate against some of the challenges that we observed. For example, within the guidance, we had to offer multi-month dispensing of medications, whereby patients would get up to 6 months of ARVs so that they actually lessen their frequency of coming to the health clinics. And this was particularly so important for adolescents who have challenges in terms of adhering to their treatment. We also targeted the elderly above 60 and those patients with comorbidities like patients with hypertension or diabetes or other cardiovascular diseases. So these ones were prioritized where they could get medications up to 6 months, but most of the other patients were able to access at least 3 months supplies of medicines. So everyone who was infected was able to access the antiretroviral therapy. Another policy decision that was made, and this was circulated through the networks of people living with HIV, was to allow recipients of care to access services from the nearest health facilities. Because we realized that some people were locked down somewhere else, away from their homes. For example, I remember a site in one of the clinics in Chitungwiza. They had over 100 visiting clients. These are people who had traveled to Chitungwiza for one reason or the other, and when the lockdown measures were put in place, they could not go back to their residences. So they had to find somewhere else to access their services. So we had to put in place also additional supplies of medications to our health facilities, like buffer stocks, enough to cater for visiting clients. And this was very helpful. Other systems that we put in place were to offer psychosocial support and counseling of patients using digital platforms. We had to use WhatsApps and text messaging and phone calls as alternate ways of communicating with our clients. We do have some patients, for example, who fail to suppress the viral load. And those patients require enhanced adherence counseling. So these were offered through the phone. So we had to adapt new ways of doing things innovatively for us to be able to continue to provide services to people living with HIV. And it worked.
That's very good to hear, right? It worked. I think that's what really matters. Thank you very much for joining us today, Dr. Apollo. But before you leave, what is your last call to action to our wider audiences when it comes to HIV-related stigma and discrimination?
Okay, so I would like to say that HIV/AIDS has been with us for quite a long time now, and there's no reason to continue to stigmatize or to discriminate people living with HIV. HIV and AIDS has become more or less like a chronic condition, just like diabetes, just like hypertension. And people are living quite long with HIV. They're living normal lives. And therefore, we should continue to support people living with HIV and support their families and ensure that they are not discriminated against.
Thank you very much, Dr. Apollo. It's been an absolute pleasure having you on the show today. And thank you for sharing with us some of the remarkable and positive progress that has been made within the health systems.
Thank you, Charmaine.
All right, thank you. That was Dr. Tsitsi Apollo, the Deputy Director, HIV and STIs within the Ministry of Health and Childcare, sharing with us some of the positive results, or some of the positive measures that the government of Zimbabwe has put in place in ensuring that we address the challenges and the needs of people living with HIV in Zimbabwe. This has been The Power of Positive, proudly brought to you by Bayete Development Institute with the support of UN Women Zimbabwe. Join us again as we continue the conversation. My name is Charmaine Picardo. Goodbye.